Hi, Liberty family. This week, our therapist will be discussing pain, and today I'd like to share the pain timeline with you. So, when talking about and assessing pain, therapists will consider and categorize pain a number of different ways, one of which is how long pain has been occurring. So, when we have pain that has occurred very briefly, lasting anywhere from a couple of minutes to 3 months, we consider this to be acute pain. Think about something that happened, like for example, a sprained ankle, where you're seeing new pain, decreased range of motion, decreased strength, and as a result, decreased participation in things that bring you joy. The next type of pain is called what we call chronic pain. So this is pain that's been lasting anywhere from more than 3 months. And then finally, the third type of pain is acute on chronic. So this is pain that's been going on for a long period of time. Perhaps it's resolved or decreased in its intensity, and then something occurs like a pain flare or an exacerbation that brings that pain back. So it's a recurring episode of pain that you've had in the past. Now, therapy for these different types of pain is going to look similar but different. So with acute pain, we'll be focusing on the specific impairments and helping you to get back to your function. As that pain progresses, though, as we move into more chronic pain, what can happen is within that 3-month period, typically the structures that may be injured the tissues have essentially healed. And what can happen with chronic pain is we see a change in how your brain and your nervous system processes sensory information from your body and from your surroundings. There's actually been extensive research that's been conducted on how our body processes pain and how our body changes when we've been experiencing pain for prolonged periods of time. While some aspects of physical therapy for chronic pain will be similar to improving strength and improving range of motion, we'll also be retraining the brain and the nervous system to function in a less heightened state or a less provocative state, along with doing those other functional movements. What I want to emphasize with chronic pain is that it's never too late to get therapy to help. So some of the things that we may work on is retraining your brain and your nervous system in conjunction with working on strength and range of motion to get you back to doing the things that you enjoy, or providing coping mechanisms so that you can do the things that bring you joy in moderation. So I want to encourage you to come back throughout the week, as we'll be posting videos on pain science and how to manage chronic pain. And then on Friday, I'll be providing a live webinar on chronic pain, where you can stick around to the end and ask any questions that you may have. Until then, move well, feel well, be well.